My name's Alison Ross. I am a nurse practitioner and director of chronic disease management and primary care for the North Zone of Alberta. So the unique challenges that I see in rural locations is one, distance. The ability to travel from one community to another or from one location to another takes far longer in rural settings than it does in urban settings. As well, recruitment and retention tends to be an issue, especially where I work is in the North Zone of Alberta, tends to be quite rural, but also very remote, and much harder to get educated professionals there. There's a number of skills that are needed in rural settings that are different from urban settings. Absolutely. In urban settings, you have far greater access to a number of specialists that can provide support. We often call them the hallway consults, where you may be working in the same office as many other professionals with expertise in different areas. In rural areas, you're much more of a generalist. You have to be able to provide care to all manner of folks in all age groups, and be able to connect with your team members and share your skills as much as draw on other people's skills from within that team setting. So I think a team is incredibly important in rural care, but harder to get in rural care just because of the recruitment and retention issues. I think there's some unique challenges by having 4 sectors of care. I do think that for primary care, we're at a real advantage. This is the first time that there's ever been an organization responsible for overseeing and providing some direction with regard to what happens in primary care. The other advantage we have in rural care is that it tends to be the same people doing the same jobs. And so we're in the same building, might be separate organizations, but we're all functioning in the same building. We all see each other every single day. So I think in some ways, rural health is at a bit of an advantage over urban when it comes to the new sectors. I think there is, to a certain extent, some protection over roles and who does what within the system. But I also think that there is plenty of work for all of us to do. And if we can put aside some of the turf wars, I think it would be much better for our patients. There is no shortage of work. There's a shortage of providers. And so why are we fighting over the same patients? I don't see a real difference there. I think my job is to provide the patient with as much information as I can so that they can make the best decisions for their health. I'm a partner in their care. I'm not directing what happens in their care. And although I can provide a ton of information in what the best evidence shows, not everybody is going to choose the best evidence. And that's okay. That's that patient's choice. I have an accountability as a provider to ensure that I'm providing safe care. And so, I think that we do need to be able to educate patients in a unique way to try and meet them where they are, but also try and gear them towards that best practice as best we can. But I'm their partner. I think the biggest strength in a rural area is that we all know each other. We're all a well-oiled machine in a lot of places. I think the challenge of that is that when there is a personality difference, that can be a much bigger deal than it is maybe in an urban setting. But making sure that members of the team fit with that team is incredibly important. And so when we're bringing new professionals into the team, they have to fit with the rest of us. So I think you interview in a different way. I think you prepare for joining the team in a different way. And truthfully, we all socialize as well, right? It's that piece outside of work as well. We know each other really well, and it makes it much easier to anticipate what the other providers might need in a given situation. The new system provides us that oversight and accountability that wasn't there before. There's an expectation that we're going to provide care to a population. We're not attaching patients to individual providers, and that's the only person delivering care. We're responsible for delivering care to that entire population. I think that's a challenge as well when we look at how difficult it can be to recruit providers to the north. But there are some real success stories out there of teams that provide care on an ongoing basis to the same population, whether or not individuals are coming and leaving that team. Digital health is the cornerstone of care in the north. You can't provide all of the services that a person needs in every single remote community. And so having access to individuals digitally or virtually is so important, not only for providers to be able to connect with other providers, patients to connect with those providers, and patients to even sit in a group setting with other patients that are similar to them. In a rural community, there might not be people with, those rare conditions that pop up. And it's important for them to be able to connect with other people that are like them, that are going through the same challenges. And I think virtual care has been one of the solutions there. It's a real passion of mine, really. The list is endless. I think anybody that patient feels is important for them to have on their team is important to be there. Absolutely, having educators, having pharmacists, community pharmacy is a huge advantage in the north. Those pharmacists know those patients as well as the providers know them. Social services, there's a ton of community organizations that support our patients across the North Zone. In fact, in North Zone, the primary care networks have promoted what they call health neighborhoods. And so they've brought all the community agencies together at one table to try and address some of the challenges of that community. And they've been a real advantage in the north because we have everybody there, and they're taking their own look at the needs of that community and trying to address them through their own initiatives. It's been hugely successful. My biggest hope is that our rural communities see the advantage that can come from having a team that provides their care and not a specific individual. I think we become very attached to having one provider, and we know there's tons of research out there that shows that continuity is important. In the north, we don't tend to have that same continuity, but attachment to a clinic or to a team that's providing your care can provide that continuity as team members come and go.